Hello friends, today we'll discuss about the orthoptics evaluation. Orthoptics evaluation. Orthoptics evaluation have three phases, right? Orthoptics evaluation have three phases. The first one is your history taking. History taking, it includes both demographic data and the complaint. Both demographic data and the complaint. Then you have to do the refraction. And the third phase is your evaluation part. Evaluation part, it have two phases. First one is sensory evaluation and the second one is your motor evaluation. So now let's discuss about history taking. History taking. Demographic data means you have to record the details about the patients, like patient name, age, gender, occupation. It is important. Occupation is important. Occupation and your address. Then we have to go for the complaint part. Complaint, chief complaint. What is the chief complaint in your orthoptics clinic of that patient? You have to record it. Like I'm not able to walk for long hours in a system or at office. You have to record that. Okay. And few complaints can be like, I can't see the near objects after 15 to 20 minutes of system use. Then you have to record that and you have to write it down. Then the complaint part is over. Then the history of you have to ask about their near working history. Near work history. Near work history. You have to ask about if the person is using computer, how long the person is using computer in a day. You have to record it, like 8 to 9 hours per day. If he is using any eye drop or not, you have to mention it. Like if someone is using the lubricating eye drop or not, you have to. So the history part is over. You don't need to ask about the allergic history and all, because we are not going to prescribe any kind of drugs in this case, because the orthoptics is based on therapies. In the second phase is your refraction. It is very much important in this. You just have to record the uncorrected visual acuity for both the distance and near. Then you have to do the retinoscopy. Retinoscopy is mandatory. Don't use AR in this case. Then after the retinoscopy is done, then do the subjective refraction or subjective correction of the refraction. That is your BCVA. You have to do the subjective refraction. And yes, of course, you have to do the diaphragm test also here. If you have the spherical power in best corrected visual acuity, then only you do the diaphragm test, whether your refraction is correct or not, just to refine it. Or if you have the cylindrical power, then do the JCC. Then you can prescribe the glass, like acceptance. You can prescribe the glass here. Why refraction is important? If someone is having some refractive error, then you have to correct it, and on the top of that we have to do our orthoptics evaluation. So we have to put that lens in our trial frame. Then on the top of that we have to do our evaluation. Okay. So now let's talk about our evaluation part. That is the third phase, right? So the third phase is our evaluation part. Evaluation part includes both sensory and motor evaluation and motor. Sensory and motor evaluation. Sensory evaluation have three things. In sensory evaluation we have three things. The first one is your Worth-Ford dot test. Worth-Ford dot test. The second one is your stereopsis. And third one is your EOM. Worth-Ford dot test is useful test to detect diplopia, suppression, or the fusion is present or not. Stereopsis is useful test to check if someone is having the depth perception or not. Then EOM is useful test to check the coordination of the extraocular muscles, right? After these things we have to go for the motor evaluation. Motor evaluation is very much important, and